Hello everyone, we are going to talk about how to make an easy and a quick audit. This will be by discussion of my first audit in my hospital, which was about compliance with prescribing extended pharmacological VTE prophylaxis following major abdominal and/or pelvic cancer surgery. This means how many patients underwent this type of surgery received 28 days Eclexane post-op, because this is NICE guidelines. You will post your audit team, but this is hidden for privacy. And then you are going to put introduction, quick, brief information regarding your topic, that a thrombus can form in a deep vein, which is called deep venous thrombosis, and can be detached and dislodged in the pulmonary trunk, which is pulmonary embolism. So rapid information. Then after introduction, you will see, because you said introduction, and then you are going to put the recommendation or the standard you want to perform at your hospital. So you will put the citation and then start talking that NICE guidelines recommend extended VTE prophylaxis for 28 days post major abdominal and/or pelvic cancer surgery. This was based on some randomized trials and the Cochrane meta-analysis, and these trials showed that extended VTE prophylaxis for 28 days by Eclexane will statistically reduce the DVT and then PE. Then, after introduction and recommendation, you will put aim of the audit, like to evaluate how many patients have been prescribed. We are not going to talk the actual, like how many patients take this medication. We don't know. We are going to ask a question. Have we prescribed this extended VTE prophylaxis following this type of surgery or no? And of course, in a selected type of patients, like patient with a bleeding disorder, patient with, so selected patients should be. After aim of the audit, you will say methods, how you collected your data, like using health records in your hospital from a period of 1 year from April 2019 to April 2020 for these selected type of patients which or who have had major abdominal and/or pelvic cancer surgery. And then you will purify these patients to a selected number, and you are going to talk about the performance. You will put these patients on an Excel sheet or Google sheet, and then you will show it, but we distorted it here for privacy. And then you will put the results sample graph, and you are going to say we included 142 patients, 47 yes received, and 53% not received. And both the sample graph, the green received and the red not received. And these patients included, please note that these are all who have had major abdominal and/or pelvic cancer surgery. Then you will say that this was unsatisfactory. And then you will say in the discussion that despite NICE recommendations, post-op extended VTEP is not satisfactorily prescribed at our hospital. And the next step, we will implement the standard at our hospital and re-auditing to complete our audit cycle. Why? Because next session, I'm going to talk about in details about that the audit cycle is composed of, you will detect a guidelines and inspect how many departments or how many consultants or juniors respond to this recommendation. And then after this, you will say your results that only 50% compliance. So after grouping the consultant, senior and juniors and saying, okay, this is our compliance with this guidelines, why we are not performing this guidance or recommendations. And they will know. Later on, they will perform this at your hospital, and then you will re-audit for another period and say, okay, after re-auditing, we detected that the 50% compliance increased to 90%, for example. So your group of doctors performed your guidance. Okay, and at the end, you will say that failure to use this guidance will, and this guidance is evidence-based, of course, this will place patients at risk of whatever. I have finished. Thank you very much. And next time I'm going to talk in details regarding how the audit cycle will go. Thank you very much.